All right. So what brings you in today?
Well, my doctor said that I should come and see you for some stuff.
Right. And do you know why your doctor recommended counseling for you?
Yeah, I've been having like some chest pains, so I went to him and got a lot of tests done, but all of them came back negative, so he told me to come here.
All right. And these chest pains, how long have you been experiencing them for?
I think the first time I went to the doctor for them was about a year ago.
And you said a lot of these tests have come back negative since then. Do you want to talk more about that?
Yeah, so when we first went in, I started feeling chest pains, and my mom told me I should go in that day to get tested because my dad died of a heart attack a few years ago, so we wanted to make sure it wasn't that. And they said everything was fine. So we had like acid reflux tested and like some other things, some X-rays done, and nothing came of it. They couldn't find anything that was wrong.
Mm-hmm. And these chest pains, are they really bad chest pains? Like on a scale of 1 to 10, like 1 being the least, 10 being the worst pain, what would you rate them?
Um, I wouldn't say that they're ever like the worst pain, but they're just like kind of there and like really like consistent throughout the day. So I would say like at their worst, they're probably like a 6 or a 7.
Mm-hmm.
But it's just annoying.
Yeah. So like on a typical day when they aren't like the worst, what would that number be?
Probably like a 5.
Mm-hmm. So they're about a 5. You say these chest pains aren't exactly like really severe, but you're still going in multiple times to get all these different things checked out.
Yeah, because like I just want to figure out what they are, and no one's been able to tell me. So like when we got the first test done, my mom was super relieved that like nothing was really wrong, but I wasn't. I'm just like I'm really worried. Like we don't know what it could be. Like maybe I could like be at risk for a heart attack, or like maybe they just missed something on like my X-ray. Because I remembered falling a few days before I started getting the chest pains, so I suggested that I get an X-ray. Maybe it was a broken rib, and when they looked, they said there was nothing there. I mean, I thought I saw like a crack on my rib, but they said that there was just something like wrong with the image on the X or whatever. But it's just like they can't figure out what it is. So I've been trying to like look things up to like when I feel the pain, like I look it up really fast to like try and like match what's wrong with me like with something online. But when I go back to my doctor or call them, they say that that's not what it is.
Mhm. So do you often find yourself researching what this pain could be?
Yeah, all of the time. Like I just want to figure out what it is. And like I was really worried the one day that like it would be something wrong with like my lungs or something cuz like that those can like also cause chest pain, so it might not just be my heart. Like what if it's my lungs? What if my lungs are like collapsing and like they're just not checking them, but they won't listen to me?
Mhm. And you say they won't listen to you. So how do you feel whenever you feel like they aren't really like paying attention to what's going on?
It makes me really worried. Like why don't they care that this is happening to me all of the time? Like they should be trying more things and like listening to me. Like I'm the one that's feeling it. They don't know what's going on.
And have you been to the same doctor or have you been to different doctors?
I mean, like I have like my regular like PCP that I go to most of the time, but sometimes when he doesn't listen to me, I just go to the ER and get like tested there.
Mhm. And so you said earlier that your mom was the one who recommended that you first go to counseling, not counseling, first go to the doctor. Is she still like supportive of you whenever you're trying to get all these tests done?
Not really. Sometimes when I'm like telling her like things that like I think it could be like cancer or like a broken rib. I don't know. When I try to tell her, she's just like kind of gets kind of annoyed and she's like, you need to stop, like you're just gonna make it worse. Like obviously that's not what it is. They already tested for that. And like she just doesn't want to listen to me. And my friends are kind of getting to be the same way. It's just like, why aren't people more worried about this? Like it's like your chest, like there's some important things in there. Like why doesn't anybody care?
Mm-hmm. And whenever you're having these pains, are you only like just having the pain itself, or is there other things that are coming along with it?
It's just the pain.
Mhm. And is that pain like the main reason why you're researching? Because you're trying to get those answers, or?
Yeah, like I want to figure out what it is, but like I don't know. Like sometimes when I start to feel it, like I feel like a like kind of like not sick to my stomach, but like you know how like when you like you're nervous, like you get like I kind of feel nervous, I guess, because I don't know what it is. So like what if it's getting worse, or like what if it hurts one time and it just never stops hurting? So like I get really worried and I just want to know what it is so I can make it stop.
Hmm. And is it just like a constant worry that you're having throughout? Is it like every day, or is it only when you feel those pains?
Normally when I feel the pain, I mean sometimes like when I'm at like the doctor, like or the when I go see someone to like get something checked out for it, like I'll get kind of anxious, like waiting for it to come back to like
Mhm.
see whether whatever it is, like if the test comes back positive.
And does your anxiety go away once you get the test done, or is it just like a continuous feeling of anxiety throughout the whole process?
It doesn't go away because, well, at least it hasn't at this point because like we still haven't figured out what's wrong, like what's going on.
Mm-hmm. And how long have you said been going to the doctor for how long again?
About a year.
And was that when the chest pain first started, or did it happen anytime before that?
No, we went like the first day I felt the chest pain, we went to the doctor.
And do you happen to remember what you were doing around that time? Like what was going on?
I think that I think me and my brother were getting ready to go we were going to like a family cabin for the weekend,
Mm-hmm.
and we ended up not going because we went to the doctor.
And do you and your family often go like on these trips together, or is it like a one-time thing?
We used to go on a couple trips every summer. Like we'd go up to our family cabin all the time. We used to go to this one amusement park all the time. My dad always liked to go to them, and then after he passed away, we didn't really go as much. I mean, we still go sometimes, but.
Mm-hmm. And then can you talk a little bit more about your father passing away? That must have been hard for you and your family.
Yeah, so he had like an unexpected heart attack, and he never had any issues before. So it was really unexpected. Nobody saw it coming, so it was pretty rough.
And I can imagine how that must be making you feel since you're yourself having chest pains and your father passed away from a heart attack himself.
Yeah, that's why my mom was super worried like at first because she didn't want it to be like something like maybe like something got passed down from my dad that they just didn't see in him previously. So that's why we went before. But after they like really know like that's not what like the doctors like that's not what happened. She was okay with it. But like I'm still kind of worried like what if I do just like drop dead one day like my dad did.
Mm-hmm. And is that a fear of yours that you're going to die from these chest pains that you're experiencing?
Sometimes, yeah, like when they're really bad and like nobody can figure out what it is and like nobody will listen to me. So like, yeah, sometimes I'm afraid.
And do you often feel like people aren't listening to you?
Yeah, all of the time. Like sometimes I'll even call my doctor and he's like, that's not what it is. We already tested for that. But it's like some tests can like you can have a false negative, like just like you can have a false positive. And my friends and stuff, whenever I like talk about it or like it happens at work and I'm like telling them that I feel chest pains, I think I need to go to the doctor. They're just like, no, like you can't leave, you have to stay. Or my friends are just like, stop it, you're fine. But like they don't know, they're not the ones feeling the pain.
Mm-hmm. And you talked about work. Do these chest pains get in the way of your ability to function properly while you're at work?
Sometimes, yeah, like I said earlier, like when I feel the pain, I like to like look it up so like it's fresh in my head, like where it is and like how it feels, so I can compare it with things. So like if I feel it at work, I like to do that,
Mm-hmm.
and then I work really close to the hospital, so I can like make a list of things, and then like on my lunch break or after work, I can just drive over to the hospital really fast.
Mm-hmm. And like the research that you're doing while you're at work and all the other times, do you find it beneficial for you?
Sometimes like in a way because I can like it gives me ideas like while I'm researching gives me ideas of like possible things that it could be but then not at the same time because like sometimes I have to take like my work home to do, which is fine because I can do that, I'm allowed to do that, but and also because like I still haven't figured out what it is, so it's getting like more in depth in the research because I'm like it's harder to find things. And
Mm-hmm. So you've been going to this doctor, you said, for about a year now, and like how do you feel that you haven't found any results to what might be going on?
it upsets me a lot, and like it's just like discouraging every time, like I must have like some like rare condition I caught somewhere, like maybe on one of our trips or something
Mm-hmm.
that we just can't think of or can't test for, because like they would have figured it out if it was something as simple as like acid reflux.
Mm-hmm. And I can imagine how frustrating that must be for you. You know, you've been going on for a year now, and you haven't been able to find any answers as to what it might be. So we definitely talked about a lot today. And if you'll be willing, you can come back for a session next week. We can go dive deep a little deeper into what might be going on for you.
Yeah, I guess I can keep trying. Come back next week.
All right. How have you been the last week?
Okay, like no worse, no better than usual. Like I was still feeling some pains and stuff, but we still haven't figured out what it is.
Mm-hmm. And so you said those pains weren't any worse than they typically were. How often did you have this pain this last week?
I had it like probably 2 or 3 times this week. Like I said, about the same as usual.
Mm-hmm. And when you had the pain, did you research as to what it might be?
Yeah, I did look up some stuff. My mom said that I can't keep going to the doctor like every day or every other day. So I started like making a list of things that it could be. So like when I do go, then I have all of the ideas with me.
Mm-hmm. And do you have any ideas like what you think it could be that you haven't researched for already?
Well, like I kind of went through some of the old things, like just in case there was like a false negative or something on one of the tests they did. But I also found like it could be like a brain tumor because like if you have a brain tumor, like it can affect different parts of your body and like make you feel pain in different parts. So I'm gonna bring that one. I think that one is a really good one to test for.
Okay, well, after going through everything that you said last week, I think I might be able to give you an answer as to what might be going on. If you'd be willing to hear, I'd be more than happy to tell you.
Yeah, definitely. Like if you have answers, no one else has, so maybe you should be the doctor.
All right, so after reviewing everything that you and I discussed last week, you said that you'd had this worry that it could be something like a severe illness, like heart attack. You said it might even be a brain tumor now. You find yourself researching what it might be, and that takes up a lot of your time. You said your relationships were strained with your mother and your friends, and it also seems to be getting in the way of your work since you are researching so much. So, what I believe that this could be is something that we call illness anxiety. Have you heard of this before?
Yeah, I've seen that before, but that just means that I'm making this up, doesn't it?
No, so illness anxiety does not mean that you're making this up. So, what illness anxiety essentially means is so you have a chest pain, and you said it's not a severe chest pain, so it could just be just a normal bodily function that you might be experiencing at that time, but you have this worry that it's going to be a severe illness. So, since you have that worry that it could be something a lot worse than what it actually is, you find yourself, researching to get all these answers, going to all these hospital visits to get answers, going to your friends and family, but nothing seems to be getting you those results that you want. So it just keeps repeating that same cycle in the hopes that you can try and find an answer for what is going on.
Okay, so I guess I can kind of see like maybe I do research a little bit too much, but like if that is what it is, like what do we do about it?
So there are a few different things that we could try and do if you would feel comfortable with doing them. The first thing that I would recommend is continuing to come to individualized sessions with me. And in these sessions, we would do something that is known as CBT or cognitive behavioral therapy. And through cognitive behavioral therapy, we can identify your beliefs, and in your case, the beliefs you have around what it would mean for you to have a severe illness, and what kind of happens when you first have that chest pain, what you automatically go to. And we can look at those in that moment and what they actually are to be able to differentiate those, like what we call cognitive distortions around what it means for you to have a serious illness. And then what I would also recommend is going through group counseling. I feel like in your case, this could be very beneficial. So you could see other people who are experiencing the same thing, might be able to help you understand what illness anxiety is a little more, since other people will be able to help you with like kind of their different coping mechanisms and things like that.
Okay. Yeah, we can try it out.
All right. So something I guess I would like to try first is just asking, when you have this pain, what is the first thing that you start to think about?
Well, when like I start to feel like I said last time, like I get worried, like, that because we don't know what it is. Like, what if something bad, like even worse, could start happening? So that's when like I like my first thought is like I'm gonna go figure out what it is, like while I still feel it.
Mm-hmm. And whenever you have that first thought, like I just want to know what it is. What does that cause you to do?
Well, I kind of like I feel like I have this like pit in my stomach because like I don't know what it is and like just trying to figure it out like is like really like frustrating when like you can't figure it out. So I just like immediately go and I'm just like okay, like look up chest pains and start from there. Sometimes like I have like other resources open and that's like the first thing I go to.
Mm-hmm. And those the different resources you have, and you're trying to get the research. Does it make that chest pain go away immediately, or does it cause like some more of anxiety about like you might have this serious illness?
No, like the researching doesn't make the chest pain go away, like and like it wouldn't because I feel like before the researching it just like I kind of just have to wait for it to go away on its own. But I guess like the researching like sometimes it's like something else to think about other than it. So like sometimes I don't notice that it's gone like it's faded back a little bit, but then I feel like okay, it's gone, like start focusing back on like whatever I was doing before.
Mm-hmm. And you said you were worried. What do you mean by that?
Like I get like kind of scared, like how is it like what if I just like drop dead or something, or what if it just keeps getting worse. So when I start to worry, I feel like I have like this pit in my stomach, and then like I guess like that's like what makes me not be able to like focus on anything else, and like if I can look it up and figure out what it is, I can make the pit in my stomach go away.
Mm-hmm. So when you have these chest pains, you are really worried that you might die.
Yes.
And that is what is causing you to do all of this research. And even though you're doing this research, you're still not getting answers as to what is going on.
Kind of, yeah. Like I mean, it's not like I am like afraid like it could get worse and something as bad as like me dying could happen, but I'm also like it's frustrating not knowing. Like I want to know what's wrong.
So not just like the whole like thought that you might die, but they also like the unknown that like this, even though this might not be a serious, it could be something serious.
Yeah, definitely.
Mm-hmm. So you said, you thought it might be like a brain tumor, and you thought it could have been like acid reflux, and you even said like you might think you might die. But those results have come back as negative, and you still haven't, you haven't died from this yet. So how do you feel when you think about those things?
I mean, it doesn't make me feel any better that it's not those things. I should, like how we went the first time and like they said that there was nothing wrong and my mom was like kind of relieved and excited. Like I think that that's how I should feel whenever something bad comes, like something that could have been bad comes back as like that wasn't what it was. But I'm not relieved at all. Like it just makes me more worried because it's like, well, what else could it be?
Mm-hmm. Well, I want to ask you, and you can like take a moment to think about this if you need to, but what do you think are like maybe 3 things that it could be that aren't a serious illness?
Like that aren't, what do you mean?
So you've thought it had, so far it's been like something that's like a brain tumor, acid reflux, a broken rib, and those are like some pretty serious things that could like infect your whole entire life. So what do you think it could be besides those things that wouldn't be considered like a life-threatening illness or disease?
So something less serious.
Yes, something less serious.
I guess it could, I think I read somewhere that like sometimes if you're super stressed, like it can cause like other things. Some people like feel like get headaches when they're stressed and stuff. If you if I changed my diet drastically, like maybe I could be like allergic to something. Like if I started eating something, but I can't really think that. Or like what like caffeine, like if I was drinking more or less caffeine, something.
Mm-hmm. And how did it feel for you to think about things that that it might not be such like a life-threatening disease?
Like to not think of the
worst to not case. Automatically go to the worst case scenario.
I mean, I guess it wasn't bad not to think of the worst case scenario for a second. But I don't know, I'm still like it was a little bit of a relief to like think that for just a second, like what if it was just stress? But like I still don't know what it is, so like it's still a little frustrating, I guess. But not as frustrating as like when I'm sitting and like at the doctor's and they're like, no, that it's not this.
Mm-hmm. And is that something that you think you could maybe try whenever, like, say you're sitting at work and you have a chest pain, and instead of automatically going to research like you usually do you think you might be able to sit there and think like, okay, let me sit for a second. What could this be besides something that's life-threatening?
Like if I start to feel it, like think like just kind of like take a second and think. I mean, I think I could do that before I start like looking things up. Maybe try to think of what other things it could be that are like not the worst case scenario.
And is that something that you think you'd feel comfortable doing?
Yeah, I could try it.
Well, we definitely talked about a lot today. And I mean, I just told you that you might have illness anxiety, so that's a lot to process. And so I think you did really well today. So if you'd be willing to come back for another session, we can continue on, trying to figure out why you might be experiencing this illness anxiety. And if you decide to go to that counseling group, we can maybe talk about how your feelings were about that next week.
Okay, sounds good.
How was your last week?
It was okay. I went to that group you told me about, so that was interesting.
Did you enjoy that group?
Kind of. Like I got more like in-depth information about like illness anxiety, and I talked with some people who like have had it for a while. So it was kind of like I like understand it more now, and like I can kind of see like why it relates to me more.
So is this diagnosis something that you feel more comfortable with?
A little, yeah. I think that I just didn't, like, I was going, like, what you told me was super helpful, and I was going off of, like, still thinking about, like, what I thought of it. And then when I, like, talked to people who, like, had a different perspective than I did, like, it was nice to hear, so I, like, understand it more.
And do you think you're going to continue to go to this group for the next few weeks?
Yeah, I think so. I think that it would be helpful to keep going.
Okay, so within this last week since our last session, have you noticed that you've been experiencing these chest pains still?
Yeah, I've still been getting them just about as much as usual. No, not really anymore.
And when you've had the chest pain, did you still immediately go into research, or did you try like take a second to think?
No, like for the first couple of times I tried to do what we did last week with like how you said like maybe try before I like jump into research, try to think of like, well, maybe it's not the worst possible thing, maybe it's just something little. So I did try that, but like I still was like when I was still feeling the pain, like I still found myself like maybe it is stress, but like what if it's not stress, and it just gave me like more anxiety. So I did like look up a little bit. I mean, maybe not as much as before, but I still was looking stuff up and calling my doctor a couple of times.
And the anxiety, do you feel that kind of takes over at that point?
Yeah, I think so. I mean, I think that if I was just feeling the chest pain and like we could figure out what it was, I think it wouldn't bother me as much. But like the not knowing and like the anxiety of like what if it is something bad or like worse than it seems, that kind of was like what makes me like want to like look into it and really figure out. Like it kind of drives me to like I need to figure out what this is.
And have you ever done anything to try and maybe lessen that anxiety that doesn't involve researching?
No, I mean besides like just taking a minute like we did last week, or like how you just showed me last week, I haven't really done anything. Like I don't really know how to make that stop. Like just like the constant worry about it.
So whenever you tend to feel that first like feeling of anxiety, is it only in your stomach, or do you feel it other parts of your body as well?
No, I think that I feel it like physically most of my stomach. Like it's just like how like when you get nervous for something or you get super worried, like I get like a pit in my stomach. And like it's almost like when I'm thinking about it, like it's almost like the pit is coming from the fact like I have this puzzle and there's like pieces missing and I can't finish the puzzle, but I can't find the pieces that are missing, and like it just like everything just gets like so like crazy.
So just the confusion around, not being able to get these answers, and you have this anxiety because like you want to find answers but you can't, is like kind of creating all these problems for you.
Yeah.
So have you ever heard of anything called like diaphragm breathing?
No.
So diaphragm breathing just essentially is a way to help you calm down in those moments when you're feeling high stress. So it's not something that that's going to help like completely get rid of your anxiety, but it might be able to help you feel more calm in those moments. That way you can like start to like calm your body down, and then even like relax your muscles, because that could be contributing to that stomach pain that you're feeling, and it might be able to help clear your mind. So I can tell you how that you can go through that if you feel comfortable.
Yeah, if you think it would help with the anxiety, yeah, we can try it.
So the first thing I want you to do is to make yourself comfortable, however that is for you, and I want you to close your eyes. So then put one hand on your chest, the other hand on your stomach, and then so you're going to breathe in, but you're only going to move your stomach when you breathe in. So breathe in for 3, hold, and then blow it out. Right, and then breathe in for 3 seconds, hold, breathe out, and then breathe in for 3 seconds, hold, and breathe out. All right, and how did you feel even just now, even though you might not have had a lot of anxiety at this very moment, but do you think that is something that you think might help when you are experiencing that high anxiety?
Yeah, I think it kind of reminds me of like meditation in a way, just kind of like taking a minute to like think about it. And like right now, like it felt very like calming a little bit. So I feel like when I'm like super anxious and like don't really know what to do, I think that like that would help calm me down for a second, and even just like making it easier to like take a minute to think, because like I'm not just like forcing like mentally like to take a minute, like I'm physically like sitting there taking a minute to think. So that could also help with like how last week we talked about like stopping and thinking like what if it's not the worst case scenario, and that was what was harder for me, was like okay, what if it's not, but then what if it is. So I think that if I tried that at the same time, maybe like it would like force me to actually stop and take a minute and calm down a little bit.
So let's say, we just have like a hypothetical situation where, it's next week and you feel a chest pain. So what do you think you might do in that moment, after hearing about the diaphragm breathing, after, hearing about taking a second to stop and like really think about your thoughts? What do you think you might do?
I think that if it starts to hurt again, like it has been like, and I start to feel anxious about it, instead of going like straight to the computer, straight on my phone, or like looking at like things that we've looked at before of what it could be, I think maybe I could try like stopping and like thinking about like what if it's not the worst possible case, what if it's just like stress or something, and then even like if that starts to make me feel anxious, then maybe like doing the like physical stopping and the diaphragm breathing to try to calm me down a little bit.
And do you think you'll be like feel comfortable doing that next week or whenever that would come up?
I mean, I think I'll definitely try it. I don't know like how it's gonna or if it will like completely make everything better, but I think that it wouldn't be like unhelpful to try.
So we've definitely talked about a lot today. So do you think you could feel like want to come back for more individualized sessions?
Yeah, I think we'll keep coming back. Maybe keep like trying some other things to like make the anxiety and like the chest pain go away.
All right, well, we can schedule an appointment for next week for your individualized session. And then I would also recommend for you to keep going to that group counseling because it seemed to be very good for you because you were able to help now actually kind of understand a little bit more about illness anxiety and you've met some other people who have gone through it. So, if you're having struggles, you can maybe next time you're in group, you can say like, oh, I was experiencing this week and it was really hard for me. Like, have you guys ever gone through this? And they might be able to help you a little bit in that situation.
Okay, that sounds good.
All right.